We have a lot of important news to get to this morning, but first, we're learning more about a rare genetic condition called Ehlers-Danlos syndrome. May is EDS Awareness Month, and this morning we are highlighting a teen living with EDS who is not letting this condition slow her down. Instead, she's empowering other children with the chronic illness. Joining me now to share more about her journey with EDS is Carrie Durso and Dr. Huang. Good morning to you both. You're with Texas Children's. We appreciate your time. Thank you so much for coming in. Carrie, I want to start with you. Talk to us about what EDS means to you and your fight, your journey with the condition.
Yeah, so Ehlers-Danlos syndrome is a rare genetic condition that I have where it causes me to have frequent joint dislocations and pretty constant joint pain. This is an everyday thing in my life and I deal with it all the time. So that means just walking down the hallway and dislocating a knee and just having to keep going with my day. I'm really grateful with some amazing medical care to be able to keep going and to have tools to be able to deal with my chronic pain, but it's a really difficult challenge being 17 years old and dealing with joints.
When were you diagnosed?
I was diagnosed in 2019 when I was 11 years old.
11 years old.
Yeah.
Are there any, when this happens or if this is about to happen, any indication that it's going to happen?
Not really. It's pretty sudden for me most of the time. I'll just fall over with a knee dislocation or I'll be writing with my pencil and my hand will dislocate.
And at that point, what do you do?
I thankfully have learned how to pop most of my joints back in myself, but that's still pretty painful and I have to go to pretty frequent physical therapy visits to manage that pain.
Yeah. Dr. Huang, what are signs and symptoms of EDS?
EDS is a condition that affects multi-system. It mainly affects the joints, but it can also affect the skin and also the blood vessel. And so it's an array of different conditions.
And how many people do you see with this condition?
Well, it depends on the different types of it, but the most prevalent type is the hypermobile type.
This is the kind Carrie has.
Yes, sir.
Yes. And this occurs in 1 out of 5,000 population.
Wow. Very rare. Carrie, talk to us about, you sort of you've taken your pain and you've made it into a purpose.
Yeah.
You're hoping to reach other people living with this condition and other rare conditions.
Yeah, so growing up with an invisible illness like I have, I was dealing with chronic pain and I felt really isolated and alone because at 11 years old, no one could understand what was going on inside my body other than me. And so I really identified with the zebra, which is the symbol for rare diseases and for Ehlers-Danlos syndrome, because of the saying, when you hear hoofbeats, expect a horse, not a zebra, which means to look for the more common illness, and this is talked to doctors in medical school. And so the rare disease community took this and used the zebra as it. And so I use that in my book, which I wrote for my Girl Scout Gold Award.
Aww. That rarity too that comes with it, right? I love the way you put that into your own words. And I know, yes, this is rare, but it's still impactful. So many people have to live with this condition in other conditions that are isolating that you just mentioned. What is your message to others, talking to them who might not have read your book or who might not have, had the opportunity to get the diagnosis that they know there's something there that they've been waiting for? What would be your message to them?
You're not alone, little zebra, and that you're not a broken horse. You're just a zebra. You weren't meant to be like others, and your symptoms are very valid. You just may not have a diagnosis yet.
Talk to us about how you facilitated this conversation with your medical professionals on getting to this diagnosis, to where you are today.
Well, I started off, I've always been a very hypermobile person, which means that your joints move more than they're supposed to. And I started having pretty significant joint pain in 2019. And I went to the doctors at Texas Children's and was like, this is an issue, can we work on this? And it took a while, and then I started having dislocations and a bunch of other symptoms, and they worked through me. I went through the pain clinic at Texas Children's, and then I got transferred to genetics. And I finally got my diagnosis with them. But all along the way, they've been incredibly helpful.
And I know right now we're watching video of This Is You. And so talk to us about what it is we're seeing. I know you talk about that flexibility and that joint mobility. we're seeing you do a form of what, gymnastics or dance here?
Ballet when I was
Ballet.
little. As you can see, my joints in these pictures, I'm moving more than I'm supposed to compared to the other children.
Yeah.
Like my joints are going the wrong direction or bending too much. It's called hypermobility, so we're hyperextending in these pictures, which as a child, I wasn't very painful. I was just aggressively clumsy because I don't know where my joints are in space.
Yeah. I asked you, Carrie, how you facilitated this conversation with your medical team. Dr. Huang, I'm interested to get your perspective on this. Treating people like Carrie in conditions like this, is there something that you want people and patients to know when it comes time to having this conversation with you or medical experts that could be helpful, that could help perhaps expedite this process?
Sure. I would say hypermobile EDS is a condition that is actually not that rare. It's more than what common people would think, and also what a medical professional would think. And it affects different body parts. And so you may have a single joint that have pain, or you may have multiple joints that have pain. You may have a single very simple kind of hyperextension of one joint, and you can also have very severe pain from a dislocation. And so to try to cope with that through and try to articulate this experience is challenging. And having said that, the mental ability to cope through that is also very, very challenging. And so to portray all these experiences requires a team, a medical profession to help start the therapy.
Yeah. Obstacles on both sides. You have children. Children are typically very active, and so that can be one challenge. But then on the other side too, especially if you live, we're fortunate that we have, Texas Children's and other networks here in the world's largest medical center. But there are people who don't have access to these types of facilities, and so that also could be another obstacle. Well, we so much appreciate your time this morning, having this conversation, and hopefully making a difference for others. Thank you both for coming on.
Thank you for having us.
Yeah, we do appreciate it. It is 8:09 on our Tuesday morning. We'll be right back. Thank you both. Thank you.